right, great job, ladies. There's no, like I said, no single right or wrong answer, but we're going to go through some of these questions and see what the actual answers were. So first question, which part is not part of the vagina? And some of you said cervix, and cervix would be correct. The hymen, the vulva, and the clitoris are all part of the vagina. Anybody know which is which?
Yes.
Go ahead.
I think the hymen is the part that when, you know, a penis is inserted to break the seal, you know, that's how you lose your virginity. And then the vulva is it right under the clitoris? I mean, yeah, under the clitoris and between the lips. It looks like. I thought the vulva like were the lips.
Yeah, vulva are the lips.
Oh.
I
thought it was the little, you know, circle.
That's the urethra.
Oh.
That's where the urine comes out. There's the clit, then the urethra, then the vagina is underneath in that.
Okay. Yeah. And then the clitoris is that outside.
Yeah, the clitoris is right at the very, very top, and of course that's the pleasure part, or part when it gets stimulated, you know, it gets aroused during sex, of course. The cervix is actually part of the uterus, which is far inside, which is the part that if you've ever had a baby and they check you to see if you're dilated, they're checking your cervix to see how much is opening so the baby can come out. So the cervix is actually the very bottom part of the uterus itself, which is where the baby hangs out, baby grows. That's where the period comes from, that little round ball up there. When people get fibroids, they're in the uterus. That's up, tucked up on the inside of you, way up high, but the cervix is the entrance to that. So the cervix is important because it can get diseases, of course. That's where the sperm has to swim through to get to the egg to make the baby. And the next question, when you do a pap smear, the main thing we're checking for is cervical cancer and cervical abnormalities. Now somebody said HPV, which is also what we're checking for when we do a pap smear as well. And HPV, of course, is a sexually transmitted disease that has been quite common, unfortunately, that can cause cervical cancers, and it can also cause genital warts. So HPV can cause warts to spring up on the cervix, in the vagina, outside the vagina, and they kind of look like little flesh moles. They can be really, really big. In the worst cases, they look like you've grown a cauliflower down there. But in the most minor cases, they look like little skin tags and moles and stuff like that. And all that's caused from HPV. It's called genital warts. Y'all like, okay. You know that? Yeah, HPV has become really widespread in the past probably like 10 to 15 years. So a lot of women do have HPV, and it can, like I said, it can lead to cervical cancer. Just because you have HPV doesn't mean you're going to get cervical cancer, doesn't mean you're going to die from cervical cancer, but once you have HPV, you have to be really careful to kind of maintain your health and maintain your body in a good place so that you don't end up getting, don't let it progress to cervical abnormalities and cell changes and stuff like that that can lead to cervical cancers. Okay. Let's see, the next question was, my vagina is most fresh when I wash with, and all you said, water, and that is correct. The vagina is most fresh when you clean with water. Now let's, again, break down the parts that we're talking about. You can clean the outside, the vulva, the labia. You can clean that with a mild soap or a mild cleanser, something like that. But you shouldn't have to put anything. The vagina is the actual part you stick things in. You shouldn't have to stick anything in your vagina to clean it. It has, your body is set up so that the bacteria and so forth in your body are meant to clean itself, unless you get foreign bacteria or a virus introduced into the vagina, which then causes problems and infections and things like that. Here's another question that we talked about before. Is discharge normal?
Yes.
Yes, very good. Y'all are smart. I got a lot of questions about discharge in my office. And typically, as long as it doesn't have a bad smell or a bad color, then discharge is a normal part of your vaginal secretions. It shouldn't be too thick or too chunky or any of those things, but if a woman will normally make discharge throughout the month. It may change from time to time depending on where she is in her cycle, but it is normal to have some discharge throughout the course of the month. Very good, very good. And you all said, how often should you douche? Never. That is so correct. Don't be sticking stuff in your vaginas. Don't be sticking no douches. Don't dip tampons in nothing to stick them in there. Don't be putting apple cider vinegar up there. Don't be putting wasps, nests, bees, nests, pearls, pellets. Don't put nothing in there to clean it because it will do it on its own. There's a lot of things out on the market now, a lot of things I hear about and see, and people come and they tell me somebody told them to stick this up there. I'm like, don't stick stuff up there that's not supposed to go in there, because otherwise you'll have a problem. And what was the other question? About pH balance, and you all were saying that pH balance refers to how acidic or how alkaline your body is, and that's true. Now, you want your body to be more alkaline or more towards neutral. A pH of like around 7, 6.9 is more neutral for the inside. However, your vagina does better when it's a little more acidic, because then certain bacteria like the lactobacilli that kind of always live in the vagina are flourishing better in that environment. When you send it out of balance, that's when you have other bacteria that can get in there and start to grow and start to flourish, and then you get all those kind of infections. You get the bacterial vaginosis and things like that. So to keep the vagina healthy, do what you do to keep your body healthy. Water, good diets. I mean, you'd be surprised how far that goes as far as keeping a healthy vagina. As far as like yeast and stuff like that, you shouldn't really be getting yeast infections all the time unless there's something else going on with you. Like if you're like diabetic or something like that, where you have a lot of sugar, or if you have a really, really bad diet and eat sugar all the time. Besides that, you really shouldn't be getting like a yeast infection all the time. So, you know, a lot of people will come in and say, oh, I get yeast infection every month. I'm like, no, that's not it. No, that's not normal. You shouldn't just be getting that for no reason. And if you think you are, then you have to take the time and go see your doctor and find out what's really going on, because the yeast infection is their symptoms are really, really classic. There's certain things. So if you have those, you don't have them things, then it's probably not a yeast infection. Thanks so much for this conversation. It's been a lot of fun for me. You guys can follow me on Instagram and Twitter at Dr. Lorie J. That's L-O-R-I-E-J. You can follow me and DM me, and if you think anything else that you didn't ask or didn't want to ask today, you can feel free to hit me up and let me know what's going on, okay? All right, thanks so much for your time. You guys have been great. I appreciate you.
Thank you. Thank you.